it's Dr. Kulbersh with Carolina Facial Plastics. Today our video blog, we're going to actually have a special video blog today with one of my favorite patients, Jeff. Jeff is actually 5 weeks after his rhinoplasty, and Jeff had a droopy tip and a little bit of a hump, and so he raised the tip of his nose and took down his hump slightly. And at 5 weeks he has a little bit of swelling left, but we are both really ecstatic with the results. But on a different note, Jeff is actually here for a different reason for today. Today Jeff has some hollowing in the temple area. And with the face, we like to look at the face and see how light plays on the face. And when we have hollowing in the temple area, we get some convexity. And convexity causes shadowing or darkness. And it just doesn't give the nice flow of the face or the nice upside down egg like I like to call it over the face. And so we want to take that area and add volume to it and make it convex. So instead of having shadowing, it's actually going to have light reflecting off of that area of the face, the temples. And it's going to be much more awake looking appearance. It's just going to make his whole face and his eyes just look better. So just looking at Jeff, and everybody has a little bit of different volumetric changes at each side of the face. Between his left temple and his right temple, he has more volume loss over here on the right side. And we just have to notice that when we're using our fillers that we're just going to need to use a little bit more volume over here to help give Jeff the best symmetry that we know how to. The temple is an area above the zygomatic arch, which is his bony area. And it's supposed to be filled with a muscle in this area. It's called the temporalis muscle. And that muscle goes and helps us close our mouth. There's also a series of fat pads that are in this area, and that seems to be the main issue with Jeff, that we've lost some volume in that fat pad. So today when we're doing the injectable filler with the cannula, we're going to be revolumizing this with purling, which is a hyaluronic filler, to give him more of this natural concavity, this kind of smoothes across there, and it's just going to make his whole face look better. So looking at Jeff, we're just going to mark out where his volume loss is. And today we're going to be doing what I call the needleless injection technique with filler, or using the cannula. So what we first do, and this is just a little bit of numbing medicine, it's a little bit of baby shot. And this is just going to be a little shot of lidocaine. This is just to numb the very end of the skin. So Jeff can just relax his head, and Jeff, this is going to be a little tiny baby shot. And through this one little hole, this one little area of numbing, we're actually going to fill the whole area through this one little hole here, and this one little hole that we're going to do right over here. So we're going to take a very small needle. This is going to make a hole through the skin to where we can put our blunt cannula. And this needle goes barely in the skin, and Jeff won't even feel this because the skin's already numb. It barely goes in. Now we have our purling, and instead of injecting with the needle, we have a long, blunt cannula on the end. And the cannula, instead of being sharp, with the bluntness, it will actually just push through the tissues in the skin. So it causes less trauma, less bruising, it's more comfortable. And in my hands, I get superior results as opposed to using a needle to inject fillers on the face. So to get this in, we're just going to go right through the little hole that we had already made. I'm just going to pinch the skin. To this we're going to do a little tunneling, a little fanning technique. And see, this is just pushing all the tissue out of the way, so it's just much more comfortable for the patient. And the filler itself actually has numbing medicine in it. So as we start, this is the most uncomfortable part, but it will all get better the more we do. And you can just see we're slightly picking up and filling the area. And so since the cannula is pushing the tissues out of the way, you'll see when it gets to a hard part, you'll see the skin bunch up, and that's because it doesn't slice through it like a needle. And so that's completely normal. That's completely how it always goes when you do fill. You'll see the skin. Actually, I mean, you can see the nice fill as I come back. You just saw it right there. So you can see the needle right here, and then you're just going to see the nice fill. I'm just working my way around to fill the whole area. So you've already started getting some good volume in the area. And we're going to keep filling this area till we get it a nice, smooth, and even. We've still got to fill. We're going to come in through this hole to inject the rest of the temple area. And then we'll keep working to fill this whole temple area. This is a great example about how we use the blunt tip cannula to fill the temple area. It's a very satisfying, a very comfortable way to inject the temples. And using the cannula, I feel like we get less bruising, less bleeding, and it's more comfortable and superior result. And we just completed filling the left side of his temple. This is immediately afterwards, and now we can see we've got nice volume on his left side of his temple. You can see he's just got a little bit of swelling where I put the medicine in to place the cannulas to do the filler, but that will go away in about 1 hour. But instead of having the indentation like he does on this side of the face, it's now a smooth transition from the cheekbone up into the cranium. And so it just gives him a nice smooth look, and it's just a really refreshing appearance to his face. And it was relatively pain-free, didn't really have much discomfort to it. And it took us about 15 minutes to do one side. And now we're going to fill the other side to get Jeff the symmetric look he's looking for. What's unique about filling the temple is a lot of people are hesitant to fill the temple, and that's because there are some blood vessels in the area that they're afraid to injure. Since I use the cannula, I feel much more comfortable filling this area because the cannula, when it gets near the blood vessel, is going to push it out of the way instead of cutting it or injuring it. So that's why with my technique, I feel much more comfortable filling the temple region. We're going to go ahead and demonstrate this one more time. And you do hear a little popping and a little pushing, and that's because the cannula, instead of cutting through tissues, it's just pushing it aside. So that's always normal, and I always tell patients, you're going to hear weird things, you're going to maybe feel a pop, and that's all normal. And we'll continue to go through these 2 holes with the cannula to fill in the temple area. And that's how I do at Carolina Facial Plastics. I fill the temples with a cannula technique. Jeff is very pleased with the results of the new volume in his temple area. He has very little bruising, bleeding. He's got a little redness from just wiping on the skin with the alcohol, but he should be fine to go out tonight and enjoy his Thanksgiving weekend. And overall, I have to say today was a great success, as we are both very pleased with the results.